This is a case of an 82-year-old woman that presented with a left hemispheric stroke, inability to speak, and paralysis of the right side of the body. With a rapid software, we demonstrated that there was a large territory at risk, the one in green, that was not completely infarcted, so we had time for revascularization. And the CTA, a CAT scan with contrast, showed occlusion at the top of the left ICA and the left middle cerebral artery. We took her to the angiography suite where we did confirm occlusion at the top of the left ICA. We proceeded with performing mechanical thrombectomy for revascularization as we navigated an aspiration A68 penumbra catheter as well as a Trevo stent retriever stent to pull the clot. As you can see in the arrow, we're pulling the retriever into the aspiration catheter. Now we're going to remove the aspiration catheter while aspirating with a 60cc syringe from the guide catheter proximally to prevent any distal emboli. Now we will obtain a new angiogram that will confirm revascularization, recanalization of the top of the left ICA as well as the left middle cerebral artery and the entire circulation to the left hemisphere. We can see in the arrow the normal left middle cerebral artery and distal vessels. This patient had a great recovery, and after spending a couple of days in the hospital, he went back home in a normal condition.